Hi, my name is Ivory Harlow. I'm the Organization Director for the Fairfield, Hocking, Ross, and Pickaway County Farm Bureau. Today we're going to talk about health benefits and insurance savings for Farm Bureau members. Stay tuned. Hi, I'm Ivory Harlow, the Organization Director for the Ross, Pickaway, Hocking, and Fairfield County Farm Bureaus. Today we're going to talk about insurance savings and health insurance benefits for Farm Bureau members. I'm here with Adam Gahm. He is the Direct Sales Manager for Medical Mutual.
Thanks for having me, Ivory.
Yeah, thanks for stopping by. So we want to talk about the benefits available to our Farm Bureau members, maybe starting off with the relationship between the Farm Bureau and Medical Mutual.
Well, that's a great question, Ivory. The Medical Mutual and the Ohio Farm Bureau have had a partnership going back to 2007, and it's continued all the way up to the present day. In the beginning, Medical Mutual and the Ohio Farm Bureau had a individual health insurance plan that was co-branded that had the association-based dues built into the premium. And so a lot of times, as you're probably aware, as you've gotten questions, what kind of plans are available? I hear about these Ohio Farm Bureau health insurance plans that were in the market. Those plans were sold from 2007 up to the full implementation of what is known as the Affordable Care Act in 2014. Under the Affordable Care Act, you can no longer have association-based dues built into a plan. So a lot of those plans that individuals, Farm Bureau members have, those are what's affectionately known as grandfathered or grandmothered. So they are still on the books, but you can no longer purchase those policies as a new plan.
Understand. Often we'll get calls in my office from farmers that either don't have access to health insurance or maybe they're running small businesses and they want to provide health insurance to their farm employees. And so really that's the motivation for talking about the partnership with Medical Mutual and what kind of offerings that we can provide. What offerings are available to individuals then? Are individual members that call my office and say, hey, I don't have access to health insurance, or health insurance is incredibly expensive, I'm priced out of the market. What does the Farm Bureau have for me?
So that's a great question. If you have an Ohio Farm Bureau member that calls you, what they have available, there are two different markets to consider when you are looking at anything that's non-group or employer-based. You have the individual ACA market and you have the Medicare market. So the individual ACA market is geared towards folks that are under 65. Those folks have what's affectionately known as public or on exchange, or private, also known as off exchange. So the big difference between the two is when somebody's talking about the on exchange or public exchange, that's where an individual can get a subsidy to reduce the premium that they would pay. And that's normally based on their income level, where they fall within what's known as the federal poverty level. And that can actually be quite extensive. So somebody making a decent income or a larger family could still get a subsidy even if they think they make too much money. But then you also have the other market, which is the Medicare market. That is a market that's focused on 65 plus in general terms, and most carriers will offer a what's known as a Medicare supplement or Medigap. Those fill in the gaps of original Medicare, or there's what's known as Part C, and that's a Medicare Advantage plan.
Okay, so what is the difference? You mentioned the grandfathered and those kind of earlier plans. What's the difference, or what's new, I guess, in the development?
That's a great question as well. New now, or after the enactment of the Affordable Care Act, all carriers that offer a plan in the individual market space have specific mandates that we have to follow when it comes to benefits, deductibles, co-insurances, wellness benefits, everything like that. So normally you'll see things fall within what's called a metal tiering. That's bronze, silver, gold, Gold, and Platinum. Those are the plans that folks are going to be looking at when I talked about being on exchange or off exchange. They're going to be purchasing an individual plan that are going to be ACA compliant.
Okay, I understand. Why would a Farm Bureau member consider an individual plan? Like, what would be some motivating factors?
So every individual or family has a multitude of different factors that are going to play into why they're going to purchase health insurance. But some main factors that I see is managing your risk. So, if you have chronic conditions or if you end up having an accident, you can incur some extensive medical claims. So when you do that, you will end up needing to have some kind of backup for that, and that's where health insurance are going to come in, because generally speaking, health insurance, or I should say medical claims, are one of the main factors for bankruptcy in America.
We also know farming is one of the most dangerous, most accident industries.
Yes.
So
yes, not to mention that with having health insurance, a lot of the plans nowadays have wellness benefits and different programs built into them that are going to promote a healthy lifestyle.
So Medical Mutual offers a variety of plans. If you want to talk a little bit about the kind of different individual options for those plans, and the eligibility of who can take advantage of those offerings.
Sure. So when it comes to the individual market, we have plans obviously on the on and off exchange channels. That's also known as the public or private exchange. That's under the Affordable Care Act. There are a multitude of different deductibles, co-insurances, out-of-pocket maximums that somebody can purchase. But the nice benefit is we have very straightforward and easy plan designs for folks to purchase when they're out in the marketplace.
I recently read that people enjoy shopping for insurance less than paying taxes and less than going to the gym. So one thing I really like about Medical Mutual's website is they make it very simple to go on there, look at the offerings, and think about the individual characteristics and how they need coverage, and be able to then either speak with a representative or get a quote directly from the website based on those offerings. So it really simplifies the process, makes it a lot more fun than doing taxes at the very least. Are there other factors Farm Bureau members need to consider when they're choosing a plan, besides kind of what we've touched on?
So yes, obviously, individuals are always keen towards maybe a particular provider system, whether that's the hospitals or the doctors. So when you're out there, you want to make sure that your doctor and or hospital system is in the network. Carriers have switched to what's known as an HMO concept. So generally speaking, you're confined to whatever network system they're providing in your particular area. Also, generally speaking, in the individual market, you will have to consider if a particular carrier services that county. So, Medical Mutual currently is in 55 counties within Ohio under different provider system HMOs. So, for Central Ohio, for example, that's the Ohio Health System.
Okay. And again, the medicalmutual.com, you can go on there, look who's in the network. There's a great article on there about the differences between a PPO and an HMO, and it seems a little bit like a foreign language, but it's spelled out very well on the medicalmutual.com website for folks that are interested in kind of shopping the plans and learning more about what plan is best for their unique circumstances. So Medical Mutual and the Farm Bureau have a long relationship. We've been working together since 2007, but maybe it would be a good idea to share with our members why Medical Mutual, why the Farm Bureau chose to partner with them, and some unique characteristics of Medical Mutual as a company.
Well, first and foremost, Medical Mutual is an Ohio-based company. Our headquarters are in Ohio. We have outstanding customer care. It is every customer care person you will receive is local. So generally, we're Ohioans for Ohioans, and we're a mutual company, meaning our members are what drive the company. We're not answering to stockholders.
I noticed down on campus, on Ohio State University campus the other day, that all the bikes are branded with Medical Mutual, which I thought was great. Back to that healthy lifestyle and promoting that healthy lifestyle. So we often have Farm Bureau members call our office asking for more information on Medical Mutual plans, on health insurance in general, and trying to demystify the partnership and the relationship between Medical Mutual and the Farm Bureau. Where can those folks go for more information, or where can the county offices point those folks to get more information?
Well, first and foremost, I would say yes, go to your county office and talk to either an OD or whoever that's specialized at that facility or that location. But you can go to medicalmutual.com and get a host of information as well and get directed to where you need to go.
The medicalmutual.com website has a full listing of plans, also has some information about the Farm Bureau Medical Mutual relationship and the special savings and health benefit options for Farm Bureau members. So I would point you to the medicalmutual.com website to get a start. And if you are a member that would like some more information, please call your county office and we can provide you with an individual who can really help you understand the eligibility in the specific county you are in. So thank you very much, Adam, for talking with me about this today and sharing this information with Ohio Farm Bureau members. I'm Ivory Harlow, and I am here with Adam Gahm from Medical Mutual. We are going to talk about the health benefits options for Ohio Farm Bureau members.
There are several options for Ohio Farm Bureau members. If you're in the individual market under 65, there are on-exchange or off-exchange Affordable Care Act plans, or if you are a Medicare eligible, that's 65 plus, there are Medicare plans, both Medicare Supplement and Medicare Advantage, that are available that a Farm Bureau member could purchase.
Hi, I'm Ivory Harlow, and I'm here with Adam Gahm, a trusted partner from Medical Mutual. Today we are going to talk about health insurance options for Farm Bureau members.
Thank you, Ivory. There are a lot of options for Farm Bureau members, and we have always been excited at Medical Mutual to be partnered with the Ohio Farm Bureau. Depending on the demographic that you fall into, so if you are under 65, you can purchase an individual policy, which is also known as the Affordable Care Act. There are two different channels, on exchange and off exchange. Or if you fall into the other marketplace, which is the Medicare market segment, those are generally for folks that are 65 and older, and there are Medigap or Medicare Supplement plans or Medicare Advantage plans that are available to Farm Bureau members for purchase.
So depending on your age would really depend on what kind of plan that you would need. Medical Mutual, though, has a variety of plans to fit members' unique needs, which folks can learn more about those individual plans at medicalmutual.com. You can also call your organization director at your county office and inquire about Medical Mutual offerings and the plans available through Medical Mutual. I'm Ivory Harlow, and I am here with James Smith from Association Benefit Planners, partner of the Ohio Farm Bureau, and we are going to talk about health insurance benefits and plans available for Ohio Farm Bureau members that are also employers. James, what are some of the typical customers, Ohio Farm Bureau members, that are coming to you seeking insurance options for their employees?
There's a large number of different situations. The Ohio Farm Bureau sponsored the health benefit plan to assist those farmers as well as everyone in between, the agricultural sector. And basically we've got situations all the way down to a sole proprietor, a single farmer that's looking for insurance options, which we can help, up to an employer with a number of employees. And the health benefit plan can assist employers with employees up to 99 employees. So we have variations there, but we also have, most often in the agriculture industry, you have family farms, things of that nature, and we work closely with them to try to find solutions. And just a couple scenarios that you may not find in the employer side of things are family farms, where you have a husband and wife, they have children, the children have now grown and have moved out on their own, but are still working on the farm. Those are situations that we can help out with the health benefits plan that the Farm Bureau has sponsored, and as well as your traditional employer, where you have employees that are not related to you, that we look to try to assist them in providing good benefits so that they attract good employees and retain those employees for long term. So the benefits plan has a lot more flexibility than what you may find in the traditional marketplace.
And we mentioned that, we keep saying farmers, but this is really farm-related businesses. So a restaurant owner
Absolutely.
that has employees that they're looking to provide coverage for, a feed store owner, for example.
Correct.
Any kind of employer that is a Farm Bureau member that is actively employing Farm Bureau members can take advantage of these plans to provide for their employees. So we're going to talk more about this later in the program. Thanks so much, James.
Thank you.
And we will be back. Hi, I'm Ivory Harlow, Organization Director for the Fairfield, Hocking, Pickaway, and Ross County Farm Bureaus. Today, I'm speaking with James Smith from Association Benefit Planners, a trusted partner of the Ohio Farm Bureau, and we are talking about insurance options and benefits for Farm Bureau member employers, so those members that are operating farm businesses.
Right. Yeah, the Ohio Farm Bureau was very cognizant of the employer challenges of finding health insurance, specifically for small employers, those small farms around the state of Ohio. And they developed the Ohio Farm Bureau Health Benefit Plan, and that plan is an employer plan, and that's kind of a key point here, because it does require a business entity in order to qualify for the plan. And in addition, that plan does allow for employers as small as 1 employee up to 99 employees. So truly small employers, but like I say, when we get into the 1 employee, sometimes that's challenging to find options out there, and this plan does allow that.
Great. Talking more into eligibility, so the specific eligibility requirements for those Ohio Farm Bureau members that are operating businesses that want to provide health insurance to their employees. What are the eligibility factors that they could take advantage of those employer plans?
Yeah, absolutely. So the number one key is obviously having an agricultural relationship and being a member of the Ohio Farm Bureau. And that's done at the employer level. The employees that participate in the plan, if an employer chooses to enroll, do pay into the plan and become a Farm Bureau member, if not already. Additionally, the plan does allow for a number of entities to qualify. So not only your traditional farm, livestock producers and crop producers, but also the extension of that. They use a farm to fork mentality, which allows not only the producers, but also those deliverers. So you'll have restaurants and grocery stores, things of that nature, that also qualify for the plan. So that's pretty key. And again, what we're looking for is employers that are offering full-time benefits. So a full-time employee would be an employee with 30 hours or more per week to qualify as a full-time employee. And again, the employer is sponsoring the plan, and they do have a financial commitment to the plan. But this is a great option, number one, not only to provide an additional benefit to your employee, to acquire and retain those employees, but also it helps the employer oftentimes, because the individual marketplace is difficult as they're looking for benefits for themselves. This provides another option that they can look to tie to their business and provide more options to not only themselves but also their employees.
Many farmers have employees that might work full-time, might work more than full-time during certain months of the year, but then during the downtime, kind of December, January, February, maybe even early March, they don't have employees on the books. Is there a stipulation about contract workers or seasonal workers for eligibility?
And every situation is going to differ, and that's what we work with each employer to find out their certain circumstance. And with seasonal seasonal employees, typically they will not qualify. We do have certain standards, typically 9 months or more per year, they're going to be required to work that 30 hours or more, just kind of as a little piece of one of the qualifiers. But when we look at a particular employee, we're looking at their specific needs. What are their employee base? How many employees? How are they structured? You know, are they a corporation, an LLC, a sole proprietorship? All of those things factor into qualifying for the plan. So we work with them to determine what's the best solution for them. And again, we'll work with them as far as those seasonal employees, things like that, to try to find alternatives for them as well, if that's a key component in them looking for the benefits.
We've been hearing a lot about the Affordable Care Act and different policies available through the Affordable Care Act. Why would a Farm Bureau member employer choose the Ohio Farm Bureau Health Benefits Plan over just the ACA market?
Yeah, great question, and this is a very different plan than the Affordable Care Act plans that are out there for employers. The Health Benefit Plan is a MIWA, which is kind of an interesting name. It's a multiple employer welfare arrangement, and what that means is it's a self-funded plan that's sponsored by the Ohio Farm Bureau, which allows the association members to come together and band together to buy basically Fortune 500 benefits, and it's self-funded, so it allows us to kind of bring about some benefit options that are not available through the marketplace. Most specifically, under that self-funded side of things, we can use a risk component when we're rating the groups, which oftentimes will allow savings of 30 to 40% compared to what they may find in the traditional marketplace.
So competitive rates
Absolutely.
is a huge
Absolutely.
benefit
Absolutely.
of choosing an Ohio Farm Bureau Health Benefits Plan over an ACA plan.
Yeah, and additionally, sorry to cut you off there, additionally, some of the biggest things that we have with regards to our partnership is we partner with Medical Mutual. The plan is run through a third-party administrator with Medical Mutual, so we use their network throughout the state of Ohio, which is a very strong network. It's not limited. Many people in the individual market see that there's some limitations on the providers and hospitals that they can utilize. This plan does not have those limitations. We use a very vast network with Medical Mutual and have them administer our claims and customer service as well, which is a great partnership, and we value it greatly.
There are some additional options too. So we want health insurance certainly and those benefits, but families are increasingly concerned about dental, about vision, about those costs can really add up. Are there options for that using the employer plan?
There are. Now the ancillary options is what we call them. So the dental, vision, those additional options, we do have partner carriers that we work with. Those aren't actually sponsored by the Farm Bureau directly, but we do have carriers that we can work with to find solutions. And again, whether it's all of those benefits or just one or the other of those benefits, we can find solutions both on an employer paid as well as a voluntary basis, where you can offer the benefit, but the employee is paying the full cost of those benefits. So there's a lot of options that we can provide. And again, that gets back to meeting with that employer, determining what their needs are, and then finding the best solution for them.
A lot of members call us with questions about what does self-funded mean? What does this mean? It sounds scary to them. They're thinking, well, what do I have to put into this to gain access to those benefits? Can you explain to us what self-funding means in terms of health insurance plans?
Yeah, so self-funding, there are some risks built into anytime you say a self-funded plan. This plan is not a traditional self-funding in that respect when it comes to the employer and how they deal with the plan. This plan is what we would call a level funded. So all of the components of a self-funded plan, the administrative costs, the claims costs, the partnership with Medical Mutual, all of those costs are paid for by the plan, and then on a monthly basis the employer will receive a monthly invoice that encapsulates all of those costs. In addition, the plan is set up in a way to protect that small employer, because we don't want an employer with 1 or 2 employees, very small income levels, to have the risk of potentially going bankrupt because of a large claimant. So this plan does have a number of protections that obviously we would discuss greatly in detail with the employer, but protections that prevent them from being responsible for any large claims or any catastrophic instances, or even if the plan were to fall apart in some way or become insolvent. All of those protections are there so that the employer, the monthly costs that they're paying towards the invoice or towards the health benefit plan are fully encapsulated, and they can walk away at any time with 30 days written notice and have no additional risk to them.
Great. Great. So the takeaway really, if I'm a farmer and I own a farm business and I have employees and I'm interested in offering health insurance options and plans to my employees, where can I go or how do I start the process if I have questions or I want more information on what's available to me through the Farm Bureau benefit plan?
Yeah, absolutely. I think first and foremost is yourself. You know, your organizational director, your local county offices. Make sure that you're reaching out to them, seeing what options are available. They certainly have our information to reach out and connect you with us. The Farm Bureau itself, the website is a great tool. You know, the Ohio Farm Bureau's website does have links to the health benefit plan. You can actually go on there and put in your personal information in order to have one of us reach out and contact you with regards to the plan. And then also we're one of the independent agencies that work with the Farm Bureau, and yourabp.com is our website. You can feel free to go out there, click on the Ohio Farm Bureau link, and that'll connect you directly with me.
Great. So if you are a farm owner and employer looking for additional information on how you can take advantage of these fantastic savings and insurance options for your employees, I'd suggest calling your county office to gain access to some basic materials. We can provide you with a brochure. We can also provide you to links to start getting an idea of what you can provide to your employees. And then we can put you in touch with an individual who can answer your questions for the available plans that might work for your farm business.
Absolutely.